The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
It was an incredible opportunity with this grant to be able to enter the realm of improving behavioral health through looking at what we thought might work and be able to explore within the community and be able to adjust through 5 years in order to really be able to make that impact without needing to do 1 year and show exactly where we went. It allowed us to be able to really explore and dive deep into the ways that we could impact mental health within Brown County.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
Connections for Mental Wellness covers primarily the Brown County community. When we talk about what population, we initially began the project looking really at employed adults within Brown County. What was very unique about this grant was being able to look at where the impact and how we could best impact, and found that as we moved through the grant and we moved through the pandemic happening in the middle of the grant, that we were really able to start focusing on all the different individuals that needed to look at being able to benefit from the work that we can do.
We have a lot of workplaces within our coalition that vary from banks to, manufacturing industries. We have a lot of counseling agencies, a lot of different organizations that work specifically within the mental health realm, as well as not in that realm. So it's organizations that you may not typically think would be involved in a mental health or behavioral health initiative.
One of the things that has been very unique about connections within our community is we have 3 major health systems that I think that many times are looked at as competing health systems. And one of the greatest initial steps within our coalition is we brought those 3 key health systems to the table, and they began as our initial partners that began to recruit and help to bring a platform to our coalition.
So one of the challenges that really came to the forefront when we were looking at doing this initiative was the access and the lack of access that we have within our community for those experiencing mental health challenges. We have some resources, but not enough to be able to really service those who are needing or seeking those services.
We have 4 of the 10 coalitions who have created what they call network of care sites. These are resource-rich websites that permit visitors to take a short screener to see if they are in need of immediate mental health. If they're not in need of immediate mental health, these sites give plenty of options of where they can reach mental health providers in their area. These include links. There are also opportunities to read up on different mental health conditions. These sites, particularly during the pandemic, were a real lifeline to the communities they served. One of the sites, the site in the Fox Valley and Green Bay area, was getting more than 2,000 hits a day. Before the pandemic, that was unheard of. After the pandemic or during the pandemic, that was the norm. So for them to have completed this journey by creating a website that helped their communities, I think is a remarkable success.
The other thing that we are doing is within our trainee experience, we're bringing trainees from across the community into one room to learn together to create this robust, homegrown group of trainees who are already, by the time they receive their certification and they go for their licensure, they're already feeling engaged and involved and knowledgeable about the community, therefore creating an atmosphere where they feel more comfortable staying within the Brown County area.
In La Crosse and the Green Bay area particularly, our coalitions have implemented mental health first aid trainings for their communities. Mental health first aid is a nationally known program that trains general public members to recognize symptoms of mental health conditions, as well as ways that just regular people can help and assist those who have these conditions. It goes a long way to breaking down stigma, as well as fostering an understanding that people with mental health are people.
So the goals that we identified within the ABH initiative for connections was to increase community access points so that other individuals within the community who are seeking services are able to have more access to them and be able to find different resources within the community and utilize those resources to their fullest potential so that they're able to get the help that they need when they need it in a very timely manner.
We have a really robust evaluation system through our mental health education courses so that we know if these programs are being effective. We also, in working with and doing our trainee courses, we're able to then go back and assess with our trainees if we're hitting the right key points so that they are feeling comfortable to stay within our community and work within our community to provide care.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
Through this collaboration, we have the opportunity to continue growth, to continue discussions, to really build upon the work that we have already started in looking at how we can change systems within our county to continue to improve behavioral health and many other issues that we see that across the board we can only look at improving when we do work as a coalition.